Hey class, how you doing today? This is Mike Schilling giving my signature choice assignment presentation on using peer-assisted learning, or PAL, to obtain a thorough medical history in the clinical setting. This is for Fresno Pacific University, ATR 710, Athletic Training Pedagogically Studies, for Dr. Jim Ave. Start off with a little bit about myself. Again, like I said earlier, my name is Michael Schilling. I'm actually a licensed ergonomist as well as a licensed athletic trainer. Basically, I go from warehouse to warehouse teaching lifting techniques and doing first aid assessments on warehouse employees, as well as desk assessments and other issues such as that. I got my Bachelor's of Science in Athletic Training from Colby Sawyer College, which is in London, New Hampshire. Actually, that's one of the main reasons that I chose to research peer-assisted learning. Peer-assisted learning was a very large part of my education, as our athletic training program was not very large. I graduated as one of 8 athletic training students, and we relied on our teachers as well as ourselves to learn the material. What else is going to go on in this presentation? We're going to go over what is peer-assisted learning, how to effectively utilize peer-assisted learning, how to obtain a thorough history in the clinical setting, a little bit of analysis, and a summary of everything at the end. So let's go over the most important part of this. What is peer-assisted learning? Well, according to Carr et al., peer-assisted learning is defined as the development of knowledge and skill through active help and support among status equals or matched companions. So what does this mean? This means that it is learning through each other and not learning through someone of a higher being. So that means as an athletic trainer, we're not learning through the doctors. As an athletic training student, we're not learning through the doctors, but we're learning through ourselves. We're not learning from a teacher, we're learning from other students. That being said, this can still mean that it is a sophomore student learning from an upper class student, like the example I'm going to go over a little later. And below the definition, we have a little example. The use of PAL has been increasing, especially in the health profession, as graduates are expected to be proficient in teaching and be competent in their skills. What this means is that the students are required to not only teach or talk about what we're doing with the athletes themselves, but we're also supposed to show these skills as well. We need to be able to actively demonstrate how to tape an ankle for students, as well as need to be able to do it correctly. A little bit more on peer-assisted learning. Peer-assisted learning can also be considered for intercollaboration between health professionals. So, as an athletic trainer, when we reach out to other athletic trainers, we are doing a version of peer-assisted learning. It's the same thing as talking as a student to student, but we're bouncing ideas off of each other. I can't tell you the number of times that I've done this with my colleagues, whether they're people that I've worked with in the past, mentors, or students that I went to undergrad with. I'm bouncing the ideas off of each other of, hey, I have an athlete with X, Y, and Z. What have you done with them before? Have you had good success? Have you not had good success with this? Or something that should be healing up in a couple weeks hasn't been healing up. Have you ever seen anything like this, and what did you do? All of which can go a long way in our profession. This leads us into our next statement by Rickel et al. Collaboration between healthcare professionals can improve the quality of healthcare provided. Other health professionals may have more evidence-based practice on something, or may have picked up or read along their career a way to help you and to advance the athlete quicker, get them back on the field quicker. That's our main job, is to be safe, to make sure the athlete is safe and healthy. But we want to get them on the field so that they're able to play and do what they're supposed to do on the field as well. What are some positives about peer-assisted learning? Peer-assisted learning encourages students to think more critically about a situation. It encourages the students to determine, to make choices of different aspects, whether it's return to play, whether it's taking a history, which we're going to go over in a little bit. It encourages them to think about aspects that they need to touch upon, that they should be doing. What else is a positive? Well, students tend to follow their peers and take the advice of other students better than they will of a teacher or of a CI. As a clinical instructor, I saw this a lot. The students listen to you, they respect you, but if another student tells them to do something another way or they've had success doing it that way, they adapt to that quicker. They go about it that way quicker. When I was teaching an athletic training student how to tape an ankle, it was funny. We had two students, and I was showing them one way. I showed them about 5 times trying to do the figure eights and the heel locks. And then the other student walked over, showed them once, and they had it. So each athletic training student learns a little bit differently. They may teach a little bit different way, but that's okay. That's what they're here for. There's 1,000 ways to tape an ankle, but they all get the same. They all have to have the same basic steps to it. Another thing about peer-assisted learning that's a positive is that it's high quality and effective learning at a cost-effective price, both in the classroom and out. So instead of hiring an extra 6, 8 teachers, this school uses its own peers, its own students to teach each other, and it doesn't cost them a thing. We're actually paying to go there. So as long as the student is competent, they can teach the other students how to utilize the skills that they're supposed to be learning. Now we talk about the competency, and we look back down here at the second. I'm going to skip the first one for a second. Look at the second bullet point. Upper class students may not be doing a task correctly and may be teaching incorrect methods to the underclassmen. I use it as upperclassmen and underclassmen because typically the upperclassmen are the ones doing the peer assistive teaching rather than the learning. They're normally the ones that the CIs, clinical instructors, rely upon to teach these skills to the other students. But if they're not doing a task correctly, it can have a large negative impact on these students. That's why it's important before the CI lets a student teach a student that they know that these students are competent in these skills, whether it's taking a history, whether it's going out in showing them how to do an assessment on a knee. All of the skills need to be there from those students. They need to know that they're doing the special tests correctly. Can they perform a correct Lachman? Can they perform a correct valgus and Barré stress test? If they can't, then they shouldn't be teaching the other students any of this information. Teachers of the peer-assisted learning and athletic training field are not certified professionals or may not have teaching degrees. So as a CI, we're normally just athletic trainers. At the college level, typically they have a master's degree, but that master's degree doesn't have to be in education. It can be in kinesiology, it can be in athletic training. They can still be a CI. So not understanding these different principles that we're going over here in this class can affect the way a student learns. We may not be as other people may not be as diverse in the teaching proficiencies as we will be when we graduate, and the other kinesiology programs don't offer pedagogical studies. Again, when applying for this program, this was one of the main classes that I looked at, and I saw that Fresno Pacific offered a pedagogical studies, while the other classes and other universities we're not offering teaching at all. Um, Having this skill set allows us to advance the skills of our students and ourselves. How is PALOS used? Well, in athletic training setting, it's common to have an upper class student, which we talked about, teaching a underclass student. The upper class student is normally assigned to a team. The school may have the underclassmen with the students to learn the proficiencies of athletic training. In my ATEP athletic training education program, it was very common for an upperclassman to have a team, especially on campus, and the freshmen would come observe. They weren't allowed to touch anybody because they hadn't gone through any of the classes. And then the sophomores would have a little bit more leeway. They'd have to meet a certain number of hours and meet certain proficiencies before they were allowed to do anything. They'd have to go through a taping class before they were allowed to tape. You have to go through lower body assessments to be able to assess a lower body. Pretty basic things, but you would learn the main skill sets from watching your peers do the test, do the assessments on athletes at the school. Why do we use peer-assisted learning? Well, students understand their classmates a little better than they might understand the professors or the clinical instructors. They're allowed to break it down to the appropriate level. We knew, as in my program, how each other learned, how best to explain things. There were some of us that were more hands-on learners like myself, and there were some people that had a little bit more of a book smart. So the book smart people could break stuff down for me out of the reading, and I could show them how to do it. You know, it's a give-take relationship. So learning how each other as classmates learn, it goes a long way. Also, the use of peer-assisted learning can help increase self-confidence. I know that when I was teaching others how to do specific tasks, it gave me a better understanding that I knew the material when I was going into the tests. It also lets you have a little bit of a leadership role. I led the others to be able to understand this competency, to be able to do a special test. It builds all this self-confidence with each other as a group, and as a class it can go a long way. Now, how do we incorporate peer-assisted learning into a lesson? Well, one of the biggest things is understanding the knowledge that each student has. So if you have two students and one is at a higher level than the other, each of them are going to have their own strengths and their own weaknesses. So allowing the person, as we'll go back to the previous example, the person that's a little bit more hands-on, allowing them to teach someone how to do a special test while the other person's a little more book smart and going through something like taking a history where a lot of it becomes common sense, but a lot of it is memorization. It's you want to hit all these checkpoints. There are certain things that you want to be able to cover in there, and learning and teaching from each other. Peer-assisted learning also incorporates and promotes the development as the student's teaching as well. So we as students teach the material to each other. Not only is someone learning it, but the other person has to teach it. So it's allowing us to understand these proficiencies a little better. And you can utilize peer-assisted learning in both the classroom setting and the clinical setting. So in the classroom, it would be something as giving a lecture like I'm doing right now, breaking it up into groups and having each other go over the next couple slides, and then one person would present the slides, or one group would present the slides to the class, and allow this sort of thing to occur, where then the teacher might step in if they miss something, but let the students themselves teach to the class. Where do we see peer-assisted learning used? Well, we see it both in the clinical setting as well as in the classroom setting. The first, the first bullet point is in the clinical setting. It's being able to teach physical examination as well as basic life support and clinical skills, utilizing each other for CPR. Um, we're learning from others that have a certain skill. It's enhancing our clinical skills. It's going over and reviewing specific techniques. I know when I first became a certified athletic trainer, before I was even hired or was allowed to tape, it was reviewing just the way that I did things compared to the way that the head athletic trainer did things. Tips, tricks, pointers were never too old to be able to learn something new because the science is always changing. If we can keep up with this evidence-based practice and have things to bounce it off of, it goes a long way in enhancing all of our proficiencies, both as a certified and as a student. In the classroom, peer-assisted learning can be used to enhance the student's experience in teaching, undergraduate training, and problem-based learning solutions. So giving a group an example of an issue or an injury that's occurring and being able to break it down and use this critical thinking. It's important that we do this because what is our BOC exam or Board of Certification exam? It's critical thinking. If we're able to bounce these ideas off of each other in the undergraduate classroom setting or even the graduate classroom setting, we can be able to break down these questions when we get to these big exams and at least make an educated decision before picking our answer. What does the research show about peer-assisted learning? Well, athletic training students that incorporated peer-assisted learning had better clinical reasoning skills. This is going back to that statement that I just made about going through the clinical knowledge. If we can break down, we can hit all these checkpoints. It's our differential diagnosis. If we can get down to 2 to 3 different differential diagnoses, we're sitting pretty. We're going to be able to get to the bottom of what's going on. In a study by Bates, 10 out of 13 participants stated that they had deeper understanding of the material upon graduation when using peer-assisted learning. It's being able to use a tool such as peer-assisted learning to be able to get the deeper understanding, to break things down. Again, it all goes back to being able to bounce ideas off of each other, and that's why utilizing an approach such as this is so very important, especially in an athletic training setting. Now we're going to go on to our example here. We have the NATA, National Athletic Trainers Association, education competencies. So my lesson that I chose to do was in clinical examination, and the exact one is clinical examination 13, obtaining a thorough medical history that includes pertinent past medical history, underlying systemic disease, use of medications, the patient's perceived pain, and the history and course of the present condition. Here's my introduction to the clinical examination. We've got the situational factor. During this competency, the athletic training student will perform a thorough medical history of an athlete for a specific injury. The injury will be chosen by the CI. The athletic training student will have the ability to learn from a senior level student through peer-assisted learning who is currently performing their practicum class with the team. So this is similar to what I was talking about before. It's an on-site student that has an undergraduate student either observing or, in this case, it's going to be following them and learning their competencies. The athlete being evaluated is a male college baseball player experiencing pain in their right throwing shoulder. Continuing on, this will be done in the clinical setting. The teaching method, of course, is peer-based learning, and what preparation the student has to have is the sophomore student has previously taken an evaluation of injuries course. The big thing that we need to look at is everything that I'm going to be talking about is going to be for the sophomore student. He's going to be doing the peer-assisted learning aspect of things, while the upper class student or the senior student is going to be doing a little bit more of the student teaching here. What's our SLO, our student learning outcome? Well, the sophomore student will be able to perform a complete and thorough medical history on an injured athlete. The athletic training student must act in a professional manner and demonstrate understanding of the anatomy. The student will be able to identify possible risk factors occurring from the injury. The sophomore student will need to identify risk factors and receive a grade of 80% or greater. Now, how is this lesson going to be perceived from the student, and how are we going to run this whole operation here? Well, it's going to be 2 weeks of a class, meeting at least 3 times per week, with the duration of the class being 60 minutes. So the 2-week total will be about 360 minutes. The sophomore level class is controlled in a clinical setting. Now, the controlled part will be for the test. However, the student will be seeing live athletes that are coming through, whether it's observing the clinical instructor performing these assessments or observing the senior level student performing assessments on them. Well, for the introduction, it's about 10 to 15 minutes. They're going to review the injury with the athletic training student, and you're going to review the checklist of possible risk factors and risk items. So how I did this when I was in undergraduate, and I wouldn't change this for the world, was my instructor literally wrote up lists of how to take a history, and it was almost a straight memorization, but it was very, very useful, because once you realized what you were going over, it became common sense. So say it was a head injury, you would have to go through the history, checking, level of consciousness in being able to perform the correct assessment skills. They had red flag items, such as going through the cranial nerves. If you forget to go through the cranial nerves in a head injury, you automatically fail. It's other items such as observing the athlete for a prolonged period of time, checking in with them every couple minutes, and making sure that they were recovering properly if there were any issues that were occurring, because it is a controlled setting, such as the athlete is now feeling dizzy or the athlete is now vomiting, and you don't do the correct next step, then the student automatically fails. Now, there are lesser items that we go through, whether it's missing a dermatome or missing a cranial nerve. That wouldn't be graded as heavily as not doing the entire assessment at all. Taking a history, whether they've had head injuries before, where they are going through the like a SCAT 3, it all will come back at the end into that 80% grade that I spoke about before. The body of the lesson. The sophomore student will practice with the senior student and observe evaluations that the senior student is performing. Being able to observe them, being able to ask them questions at this time is where the bulk of this lesson is going to be learned. The sophomore student will have access to athletes under the direct supervision of the clinical instructor. Again, this has changed a little bit since I was in my athletic training education program. As an undergraduate, I had full access to the students as soon as I finished the class. Now I want to make sure that I'm sticking with all the CATIE standards here, and they have to be under the direct supervision of the CI at all times, both student, that is. For the conclusion of this study, we will be doing the reviewing of the actions that were made by the athletic training student and review key aspects that were missed by the student, allowing them to have questions at the end. So we go over the big key aspects that they missed. We go over the little things that we missed. Again, like I said, we have a checklist. If an item wasn't covered, we review this with them. This is not the test aspect of things. It's allowing them to make mistakes. It's allowing them to ask why they didn't do specific skills, and then giving them an opportunity to either, number one, explain themselves, or number two, to just show them how to properly do it. How will this be assessed? Well, the testing will occur at the end of the second week of class. The student will be required to perform a complete and thorough history of an injury. So, they have to be able to perform a spot-on, complete history of an injury. The student will be graded on this checklist type system and must display 80% competency of the graded aspects. Once the athletic training student is deemed competent, then they will be allowed to have some leeway and be able to start to perform some assessments of injuries, or at least take histories under the direct supervision of the athletic training. In conclusion, utilizing peer-assisted learning in athletic training setting will help both sets of athletic training students ascertain competency in the material that's being covered. Using this peer-assisted learning, as we talked about before, will allow the students to get a real understanding of the material that is being covered. It will allow them to demonstrate that they do understand the material deeply, and being able to teach as well as being able to learn from each other will break it down to the level that we need to be at for each other. So we have questions here that we want to cover. What have you learned about peer-assisted learning? Would you incorporate peer-assisted learning into your teaching style? Why or why not? And did peer-assisted learning help you while you were attending your athletic training education program? Again, I stated how much this meant to me when I was in my athletic training education program, and I'm assuming that most of you have had a lot of experience with peer-assisted learning throughout your career, if not through your athletic training education program. I thank you for taking time and listening to this, and I hope you enjoyed it. Thanks, guys.